it's my pleasure inviting Dr. Harsha Jayakody. He's the Medical Officer, Health Informatics, founder of My Doctor Sri Lanka, and also he is a healthcare entrepreneur. So he is here with us to talk about the role of ICT in healthcare and remote patient monitoring system. Over to you, Doctor.
Thank you very much. Hope you all can hear me.
Yes, sir, we can hear you.
So, good morning, everyone. So today I'm going to talk about the role of ICT in healthcare and remote patient monitoring. So we live in the 21st century, and we know that it is called the informative age, where all the technology and everything has come into a place. So during this informative age, which is in the modern history, so there's a digital revolution taking place throughout the world, where the technology is replacing number of industrial machinery and also the human resources. So every day new innovations are coming up, and with this advancement of technology is aimed in making lives more easy. So to provide a fast, a more convenient, a better quality service at a lower cost to individuals, man has started digitalizing certain services. So we know that banking sector, education sector, security sector, communication sector, all these sectors are getting digitalized. So when we talk about digital adaptation of these sectors, there are three keywords that one should know. So those three keywords are digitization, digitalization, and digital transformation. So when we talk about digitization, it is the conversion of analog data into digital data. We know that we have been used to analog world where paper-based medical records, everything is there. So with this digitization, we go into a digital records, not only in healthcare, I mean in all the industries. Then digitalization. So digitalization is where you get this new processes. Because of the digitization, you get new processes lined in to fix this. Then we come into digital transformation. So finally, by creating a new business avenues, the digital transformation is being performed. So information and communication technology, ICT, plays a very vital role in this digital adaptation. So when we consider about healthcare, so there are certain problems in healthcare. So especially the resources are limited in and disproportionately condensed in urban areas, where in majority areas of countries like us, where the resources are poor. Therefore, the accessibility is a major problem in healthcare. Even in urban areas, also we have certain other problems that encounters. Some are traveling because people has to travel to a place, and there's a cost for these things, and also there's a lot of time consuming. And then the customer experience, the consumer experience may also play a vital role, which may also be a problem for some people. And then the information requirement, then people may not have information required. Then, so these are the main problems in healthcare. So in information and communication technology plays a vital role in healthcare. So ICT can be useful in healthcare in many ways. So it can increase the accessibility to services. So as I told you, this is a big problem with accessibility. So this ICT can give a solution to increase the accessibility to services. And then it can improve communication between the stakeholders. So the doctors, patients, laboratories, pharmacies, hospitals, all these stakeholders can be connected. So it can improve the communication and the storing information methodology, which can be used at anywhere at any given time. So storing information with help of ICT will create a huge impact. As Dr. Kitsiri spoke, there we talk about data lake, uh, big data analysis. So all this information needs to be stored properly. So with this ICT, we can store information properly where it can be accessed anytime, anywhere. It can lead to improvement of the health research analytics. So healthcare research can be done well with ICT. Then reducing operating and administrative cost. As I told you, there's a cost factor everywhere in healthcare, so this also can be addressed. Then because the use of AI and other technologies, it can reduce the medical errors, human errors, when as well as other errors by using technologies like AI. Then it can also be used for health education. So ICT can be used in healthcare for health education, not only for students, as also for doctors, nurses, and other healthcare uh, professionals. And overall, it can improve the health system efficiencies overall. So we'll talk about how this ICT increase the accessibility. So Dr. Kitsiri also spoke. So telemedicine. So telemedicine is a vital plays a vital role, especially with this COVID-19 pandemic. Telemedicine has becoming very popular. So telemedicine gives the benefit of accessing medical care to patients in remote locations quickly and more convenient. So there's no hassle of traveling, and the availability, especially 24/7 availability, is there with telemedicine. And people can access to healthcare from comfort of being at home. So there's less exposure to infection, especially during this time of during this time. So telemedicine is consulting a doctor or any healthcare professional through using of this ICT technology. So interaction of telemedicine can be categorized as pre-recorded or real time. So real time is where we use audio, video consultation. So recorded, pre-recorded are where we use emails and other sort of digital X-rays to teleradiology, teleophthalmology, like those type of things. So as I told you, audio is the simplest form of telemedicine used in the world. The recent developments in ICT allowed a new era of mobile telemedicine via video conferencing. So video conferencing has been popular now with this COVID-19 pandemic. So these are the new ICT innovations in healthcare. So with the video conferencing, a patient can talk to a doctor who may be 100 miles, 1,000 miles away and get a medical advice. He or she can show his or her rash or any other medical records, share any medical records with that consultant or doctor or any other healthcare professional. So through telemedicine, even e-prescriptions also has come. So with e-prescriptions, people can increase the accessibility to medicine. People, consumers can get medicine delivered through e-prescriptions. Then they can uh, get a prescription from a doctor who is away. So those are lot of benefits of telemedicine. So just think, with this ICT advancement, have possibilities in healthcare, such as a diabetic child living in a village can receive medical advice from a pediatric endocrinologist living in a city. See how helpful it can be. A senior citizen with a heart disease could be monitored daily at home, and her drug dose can be adjusted by the general practitioner to reduce the problems that can cause unnecessary emergency visits. See the convenience that can be added by telemedicine. And there are certain other benefits also. A young man would get advice on his sexual problems without being embarrassed at the public health setting. So these are the things that telemedicine can fit in. Then there's something called teleradiology, which is becoming very popular these days. So interpretation of medical images while not physically present at that location where the images are generated is called teleradiology. So when a radiology image is taken, it is sent to some other place where a consultant or a doctor is there where he can interpret this. The accessibility of radiologists increases as they provide their services without needing to be sit at the same location as the patient. So there are certain uses of this teleradiology. Doctors can collaborate and consult with their colleagues who are in other locations to assist diagnosis and management. And areas with less availability of specialists can get support from areas which have high availability of specialists. Then storage of images for follow-ups and medical legal purposes can be done through this teleradiology. Then with this ICT innovations, there are something called healthcare kiosks. So you can see in this picture a healthcare kiosk, a machine, which can be set up at working places or even at public places. So the access of healthcare can be provided 24/7 through this healthcare kiosk. We have seen this other type of kiosk where people used to for reloads and certain other mobile payments. So this is a healthcare kiosk, so which can be used for wellness and preventive measures and for remote patient monitoring. And there are something called healthcare kits, which I have shown in this picture. So these are used in remote or mobile healthcare clinics or set up in ambulances. The beauty is that these equipments can push health data to a cloud which can be accessed from a distance. Then we come to a most important topic, which is artificial intelligence. So artificial intelligence applications in healthcare will provide certain new, will give a new set of innovations. As an example, AI can be used to diagnose critical diseases. So if AI can be put to medical imaging, it can detect tumors, detect any abnormalities. Then AI-based chatbots can be used as medical assistants. So for busy clinics to schedule doctor appointments, as medication reminders, then identify certain conditions based on symptoms. This where AI chatbots can be used. Then AI-powered surgical robots are being used in the world. So machine learning applications provide less damage, increasing precise and speedy recovery. Then artificial intelligence in pharma also plays a large role. So it increases efficiency, then improve lab safety, prevent and halt or reverse aging process, with personalized medicines. So we are now talking about personalized medicines for cancer patients, for other ailments. So AI can provide personalized medicines. Then AI can be used for lifestyle management and nutrition to encounter individual risks for lifestyle diseases, customize recommendations and suggestions based on a person's preferences and habits. Then AI can be used in mental health. A virtual human interviewer which engages in interactions with patients at deeper levels can be used. So these are some places where AI fits in healthcare. Then with ICT advancement, there are virtual and augmented reality used in healthcare. We call them VR or AR. So virtual reality is playing an increasing role in healthcare. So it is used to overcome mental health issues such as phobias, stress, and anxiety. Through this virtual reality, you can create a virtual world where a person can be exposed, can gradually exposed to reduce their phobias and prevent anxieties. And then health education is also part of this virtual reality, which where surgeons can use this virtual reality for practicing surgeries in a virtual world. And then rehabilitation plays a key role in virtual reality, where uh, virtually we can assist people to do their normal day-to-day things and then rehabilitate them from strokes, from other ailments. Then wearable technology, which is called Internet of Things, IoT, also plays a large role in this ICT advancements. Healthcare delivery model of bringing care closer to a patient with this IoT. So latest ECG monitoring, which can predict rhythmic disorders. Then blood pressure monitoring, which can give a 24-hour blood pressure monitoring through these wearables. And then blood sugar monitoring with the help of nanotechnology and other new advanced technologies. Then there are certain equipments that can be worn to prevent epileptic seizures. See how much of life saving we can do with this new technology. And then these IoT devices are used for distance patient monitoring. So what is the future? As Dr. Kitsit told, we are going towards a virtual hospital reality. So virtual hospital is where true patients and doctors are not there in a same room, where all these stakeholders are connected through virtual. With this virtual hospital, smart hospital is also a new concept. So as I showed you kiosks, where robots can be used. So smart hospital is also a near future thing. And then there are something called smart homes or smart toilets. Uh, when you urinate, it will analyze your urine and gives a report on your urine sugar, your urine nitrogen levels, and albumin levels, like that. So, and it will predict your future diseases. So this type of lot of advancements are there with the future. So I'll just quickly take you through a small video.
Alexa, open My Meds.
Hello, my friend. It's time for your 9 a.m. medications.
Remind me, what are my meds this morning?
Your meds are metformin, 500 milligrams, and lisinopril, 10 milligrams. Would a picture help?
Yes, send me a picture.
Sending now. What else can I do for you?
Remind me, what are these meds for?
Metformin controls your sugar. Lisinopril controls your blood pressure and protects your kidneys. Anything else?
Record that I'm taking my morning med.
To find out how.
Alexa, open My Meds.
Good to hear your voice. Looks like you have 2 alerts. One is a refill alert for metformin 500 milligrams for sugar control with a copay of $10. Would you like to accept this med?
Yes. What's the next alert?
You have a new medication for Nasonex, a nasal spray for your allergies. Your copay is $10. Do you accept this med?
Yes, I need that.
Would you like pickup or delivery?
I'd like it delivered at dinner time.
Your usual delivery?
Yes. Do I have any rewards?
You have 5 reward dollars. Would you like to apply your rewards?
Yes, apply them.
Done. Your total comes to $20 with delivery. Would you like to pay with your card on file?
Yes, pay with my card.
So see the how ICT had made things different. So this is Alexa, where a person can just talk to equipment which is connected to cloud, and all his medical data is stored in that cloud. So see how he can access those information and see how he gets the advice from that equipment. So it is how the technology can help in distance monitoring. And then to end, we see a lot of challenges also with this ICT development in healthcare. One is low computer literacy. So low ICT skills will create some challenge when using this type of equipments, then wearables, and then other technologies. Then poor ICT infrastructure and poor support will also be a problem. So if you don't have proper internet connection, then proper infrastructure, then you cannot access these new technological things. And then the society has less acceptance because they are not willing to change sometimes. This telemedicine has been there for a long time, but people is not adapting to these new changes. But we have seen with this COVID-19 pandemic, people are changing to adapt to more digitalized. And if you have lack of communication skills, it will also affect this type of technologies. Then some high expectations from healthcare professionals will also meet certain challenges when innovations are considered. And then certain data security concerns. So because this data is stored in cloud, there may be data security concerns with people. And then due to lack of laws, policies, regulation, and governance, sometimes it may challenge this type of ICT innovations. So thank you very much. I hope you had got an idea about how ICT developments can be helpful in healthcare and also remote health monitoring. Thank you very much.
Thank you so much, sir, for the very enlightening and interesting information you shared regarding telemedicine and involvement of ICT in healthcare development. Thank you so much for that, sir.